wearable injectors and connected devices market has grown rapidly over the past few years. So, what key differences have you noticed in the last year regarding significant developments?
Yeah, thanks, Katie. First off, I'm quite excited for the conference and look forward to hearing all the great insights from others in industry. I think, in particular, for wearable injectors and connected devices, these are two core technologies for helping us achieve sort of therapy at home, in particular. Um, uh, our approach has been to look for wearable technologies and connected device technologies that can help patients have a choice at a minimum, have a choice to either go to an IV infusion center for therapies as they would traditionally do, or as we're seeing growing demand and interest for delivering these therapies at home. And the reason these two technologies are so key to that is because the wearable technologies allow us to deliver higher volume of drug than we could in a pre-filled syringe or an auto injector. And so that's one key change that we've seen in the past year, is that more of the therapies that we want to move from IV to home have significant volume requirements. They sometimes also have significant viscosity requirements that have to be dealt with by some of the injectors, but maybe more so than viscosity, this increase in volume is really the way we can enable the home delivery of some of these medications. And then on the connected device side, whether it's the wearable itself that has connected components or that we're delivering other types of digital solutions for these patients, what we're seeing the need for is, in order to support patients to feel confident and comfortable and competent with their home delivery, digital tools and the types of data we can generate from the drug delivery devices, but also even things like being able to do a quick video chat with a nurse can really enable these technologies to be used most effectively by patients. So those are some of the areas where I'm really excited to hear what others are doing and how they're helping achieve sort of what you might call a more patient-centered view of drug delivery.
Yeah, and then I guess to just go on from that, what do you see as the greatest challenge facing the industry at the moment?
Yeah, there are so many. It's kind of hard to pick what might be at the top. I would say, we're in the early days of understanding what the capabilities of some of these wearable technologies are. What is the highest volume we can deliver over what period of time? I think on the patient-centered aspects of it, what can we do better in the design of these solutions to make it even easier for patients? So I think all of these therapies can be great, but if a patient can't figure out how to do it for themselves or even with a caregiver at home, overcoming that challenge is critical. And in many ways, we have to learn by doing. And we have to get more experience with patients using these products. So I think that that's a couple of the biggest challenges that we face, especially on the technology side.
Yeah, and then on a final note, I know you've sort of mentioned this, but why do you feel it's important for the industry to join this year's conference?
Yeah, I think it's critical for people to attend to learn the latest and greatest, both in what's available with these technologies, but perhaps in particular to understand what might be possible and where do we need to do more work or make more investment, what types of patient populations these technologies are most appropriate for, et cetera. And so I think, a conference like this is where we can all come together and learn from each other, and then go back to our respective companies and sort of translate that into new developments, new actions to improve the likelihood that these technologies will be successful for patients.
Yeah, well, we can't wait to hear more from you and our other speakers at the conference too, later in September in Boston. And for everyone to see the full agenda and book your place, head to the SE Media website. And yeah, we hope to see you there. Thank you, Paul.
All right, take care. Thank you.